See important safety information at the end of the video. Only your doctor can determine if this therapy is right for you.
My name is Janet. I have a husband named Andy and 2 little boys, Drew and Josh. My story began actually the night before Drew was born. I ended up with food poisoning. I was up all night throwing up. I was very sick, and then the next morning around 11 a.m. I started having contractions. But Drew got stuck actually coming out of the birth canal, so they had to use suction to get him out. As a result of that, I actually had a severe tear. Drew, luckily, was healthy. I unfortunately started to get very sick because I had food poisoning so bad, and I was experiencing diarrhea. I actually got a severe infection. So as a result, I ended up going to intensive care. Life was really hard. The first memory that I have of being in my home was looking at the stairs where my bedroom was and being so sick, and it was overwhelming to think of simply walking up the stairs, let alone taking care of my new baby. Originally, I did go to a pelvic floor specialist, and what I was told was kind of this is how it was going to be for me. My biggest problem was frequency, urgency, accidents. Instead of twice a day, I would have to go sometimes 8 to 10 times a day. And the urgency was I would have to get to the bathroom within about 30 seconds. It's hard to be a grown woman and having poop accidents is really difficult. Andy was always awesome, super understanding, excuse me. You don't feel very attractive when you wear a pad in your pants and daily you have accidents. But he knew I couldn't help it, and it was something I didn't choose, of course, and he always chose to be supportive and to be there for me. And then I had my second son, Josh, in January of 2014, and my mom's cousin gave me the name of some doctors, colorectal specialists, that actually got me to the right place to see Dr. Vogler. And after seeing Dr. Vogler the first time, I felt like I was finally in the right place and I was gonna get the help that I needed. They initially put in the device. You do a trial period for 2 weeks. During that 2-week period of time, my accidents went from daily to almost none, so the change was huge. For me personally, the difference in my everyday life, being able to do what I want to do with my family and friends, to be alone and intimate with my husband and not worry that I'm going to have an accident.
I would say it's definitely easier because we can always go do whatever we want without her having to run off.
I can focus on what I'm doing. I love to be with my family. We're very active. We have a hockey pond in our backyard, so we all skate together as a family. I'm a runner, so I can go out long distance running with my friends and not always have to run close to a gas station. I've done a few sprint triathlons, and last year was my first Olympic length triathlon. My next goal is a half Ironman at some point, and my devices help me to be able to do so. The only problem I've had with my system is the stimulators on my left side of my pelvic floor. So every once in a while I feel it in my left leg. I went in to see Dr. Vogler and I got a new program, so I don't have that problem anymore, so it was an easy fix.
To see the difference in life quality, I can't imagine how good it must feel to not have to deal with that stuff anymore.
The results are beyond my expectations. For me, it's been life-changing, and most importantly is it could help you too.
Medtronic Bowel Control Therapy, delivered by the InterStim system, treats chronic fecal incontinence, an accident or leaking involving stool. It should be used after you have tried other treatments, such as medications and dietary modifications, and they have not worked, or if you are not a candidate for them. You must demonstrate an appropriate response to the evaluation to be a candidate. You cannot have diathermy, deep heat treatment from electromagnetic energy, if you have an InterStim device. Safety and effectiveness have not been established for pregnancy and delivery, patients under the age of 18, or patients with neurological diseases such as multiple sclerosis. In addition to risks related to surgery, complications can include pain at the implant sites, new pain, infection, lead, thin wire, movement, migration. device problems, interactions with certain other devices or diagnostic equipment such as MRI, undesirable changes in urinary or bowel function, and uncomfortable stimulation, sometimes described as a jolting or shocking feeling. Consult your doctor to decide whether the therapy is right for you. A prescription is required. For complete safety information about Medtronic Bowel Control Therapy, call Medtronic at 800-328-0810 or visit Medtronic's website at everydayfreedom.com/bowel safety.